Two questions. Some experts say there will be a peak in cases soon because we do not test asymptomatic patients. Is this true? And do you think we've passed that stage where we're supposed to have our peak or not? Second, there have been reports that Covid-19 have mutations and there are like 3 different variants all over the world. Is KKM taking note of this, and is it a concern so far in managing the pandemic? Thank you.
Okey, persoalan sama ada kita ataupun kita dah berjaya menangani COVID-19. So I think I answer your question in English lah. So first is that our JP Morgan has actually predicted that we will have a peak on the 14th, that is tomorrow, 6,300 cases. Today we have seen our cases 4,817. Our target is to have the cases less than 6,300 cases as predicted by JP Morgan. I think we are certainly doing much better, and perhaps tomorrow we will know perhaps we are less than 5,000 cases tomorrow. I think I'm just predicting tomorrow. Hopefully, touch wood, that we can bring it down to 5,000 cases, which mean our action of MCO 1 and 2 is working. And this is a sign that showing that there's a succeeding sign that we are able to contain as well as reduce the cases, flattening the curve. And when we look into week 13, and there is actually a peak, now perhaps we are in a recovery phase, but we are still monitoring closely because we have not managed to bring it down further. So we need to bring it down further, and this is why the third MCOs is very important for us to bring it down further. If we can do that, there is a possibility we can reduce the cases, not only flatten the curve, but a possibility for us to end COVID-19 in this country. But we hope that we can do, but it's not only depending on Ministry of Health, it's depending on all of us now. If all of us can work together, I'm sure we can do that. Then with regards to the cases, for example, in terms of screening, we have screened 83,488 cases. Cases. Positive is only 4,817, which means it's only 5.8%. Recommendation by WHO is about 10%. And doing the enhanced MCO, whereby we screen everybody. We test everybody, whether symptomatic or not symptomatic, whether they are in a high-risk group or not. For example, in Simpang Renggam, in Hulu Langat, we are doing that. What we found is that when we screen everybody in that area, our detection rate is not 5.8%. 5.8% is the one that the PUI, close contact, and those coming back from Misi Bantuan. That is 5.8%. We only found 0.5% positive, which means if we screen 1,000 people, the percentage is only 0.5%. So the detection rate is very low. So in that sense, we believe that in the community, we are able to do much more in that sense that whether we should do test for everybody, or we prefer to do test for a targeted group, targeted site, targeted high-risk group. And then perhaps we can get the better outcome with the limited resources that we have. Then we can focus into that area, we can focus into that high-risk group, and perhaps that is a high impact, reasonable cost with our limited resources that we have and good outcome. Rather than if we screen everybody in that community, your detection rate is 0.5%. That is from the experience from the enhanced MCO region. Because in enhanced MCO region, we make sure that we screen everybody, whether symptomatic, asymptomatic, high-risk group or not, we screen everybody. So that is our detection rate. That is the data showing us whether we should embark on test for everybody or focus on the site, focus on the high-risk group.